Do you often feel drained, even after a full night's rest? Or maybe you've started noticing some numbness or tingling in your hands and feet. These could be signs of something you might not expect, especially after turning 50. But what if I told you that these could be warning signs of vitamin deficiencies that affect many adults as they age? In today's video, we're diving into the top 5 warning signs of vitamin deficiency after 50 and how they can impact your health. Stick around because we'll also talk about how you can prevent these issues and feel your best again. Let's jump right in. 1. Persistent fatigue and weakness. The energy drainers. Are you constantly feeling tired, even after a full night's sleep? Many people over 50 experience this kind of persistent fatigue, and it's often linked to vitamin deficiencies, specifically vitamin B12, vitamin D, or iron. These essential vitamins play key roles in energy production and overall health. So when they're lacking, your body struggles to function at its best. What exactly is going on? When your body doesn't have enough of these nutrients, it can't produce enough red blood cells to carry oxygen throughout your body. This leads to a lack of energy and can make even simple tasks feel like a chore. You may wake up feeling tired, struggle to get through the day, or just feel like you can't summon the energy you once had. If you've been noticing this, it could be time to check your vitamin levels and speak to your doctor about it. Now, you might be thinking, I get enough sleep, so why am I so tired? Well, our bodies change as we get older, and so does how they absorb nutrients. Vitamin B12, in particular, is harder for the body to absorb as we age, especially if you have a history of stomach issues or take medications that reduce stomach acid. The best part? Once these deficiencies are addressed, you'll likely notice a significant improvement in how you feel, more energy, better mood, and an overall sense of vitality. Additionally, vitamin D plays a big part in immune function and overall well-being. A lack of vitamin D can also make you feel sluggish or experience muscle weakness. If you're feeling like you don't have the energy to do the things you used to enjoy, getting your vitamin D levels tested might be one of the simplest steps to feeling better. 2. Numbness or pins and needles, a sign of nerve trouble. If you've been experiencing numbness or that familiar pins and needles sensation, especially in your hands and feet, you might be dealing with vitamin B12 deficiency. This sensation, also known as paresthesia, is a primary warning sign that your nerves are not getting the support they need from essential vitamins. Why does this happen? Vitamin B12 is crucial for nerve health and function. Without it, your nerves can become damaged, leading to tingling, numbness, and even balance problems. Over time, if left untreated, this could lead to permanent nerve damage or other more serious health issues. And no one wants that, especially as we age. It's not always obvious, but this numbness can sometimes feel like a minor discomfort. However, don't ignore it. Persistent tingling could be signaling that something's not right, and it might be a good time to consult a healthcare professional. The sooner you address this issue, the better your chances of reversing the damage and preventing future problems. For people over 50, this feeling could also be a result of reduced circulation or nerve deterioration due to poor vitamin absorption. While age and lifestyle factors such as diabetes or high blood pressure can contribute to nerve problems, vitamin B12 deficiency is often the key factor and can be easily addressed with diet changes or supplements. 3. Bone and joint pain, when your body support system is at risk. As we age, bone and joint pain becomes a common complaint. But did you know it could be linked to a vitamin deficiency? Specifically, vitamin D and calcium are essential for maintaining healthy bones and joints. If you've been experiencing deep, aching pain in your bones, particularly in the lower back or legs, it could be a sign of vitamin D deficiency. Here's why this happens. Vitamin D helps your body absorb calcium, which is crucial for strong bones. Without enough of it, your bones can become weaker, leading to pain, increased risk of fractures, and even conditions like osteomalacia, a condition that causes softening of the bones. Over 50, this risk increases. So it's important to monitor your vitamin levels and take preventive steps to protect your bone health. Another reason to take this seriously is that joint pain can often lead to mobility issues, make it harder to stay active and enjoy daily activities. If you're feeling these aches, it's a good idea to get your vitamin D levels tested and consider incorporating more calcium-rich foods into your diet. Adding a simple supplement could help you feel more flexible and less painful, so you can keep moving comfortably. In fact, vitamin D is sometimes called a sunshine vitamin because your body makes it when exposed to sunlight. However, as we age, our skin efficiency at producing vitamin D decreases, which is why it's important to include vitamin D-rich foods like fatty fish, egg yolks, and fortified dairy in your diet or consider supplements. For cognitive changes in brain fog, more than just aging, have you found yourself forgetting things more often? Maybe you've been experiencing difficulty focusing or remembering simple tasks, like where you left your keys or what you had for lunch. These cognitive changes, including feeling foggy or mentally sluggish, could be early warning signs of vitamin B12 deficiency or a B-complex deficiency. As we get older, it's normal to experience some degree of forgetfulness, but when these cognitive issues start interfering with your day-to-day life, it's important to pay attention. A lack of vitamin B12 can affect your brain function, leading to memory problems, confusion, and an overall sense of mental fog. In some cases, these symptoms may even be mistaken for the early stages of dementia, which is why it's crucial to get an accurate diagnosis. The good news is B12 deficiencies are often treatable through diet changes or supplements. So if you're noticing these symptoms, don't brush them off as a normal part aging. With the right interventions, you can keep your mind sharp and your memory intact. So, if you're feeling foggy, speak to a healthcare provider about getting your vitamin levels tested. It might just be the answer you're looking for. In addition to B12, B-complex vitamins like B6 and B9 also support brain health. Together, these vitamins help create neurotransmitters that regulate mood, cognition, and memory. If you're experiencing difficulty concentrating or frequent forgetfulness, it's a good idea to consider including these vitamins in your daily routine. 5. Muscle cramps and weakness. When simple movements become a struggle. If you've been experiencing unexplained muscle cramps or struggling with simple activities like climbing stairs or carrying groceries, this could be a sign of vitamin D, magnesium, or potassium deficiency. These essential nutrients play a crucial role in muscle contraction, strength, and balance, which are necessary for everyday movement and avoiding falls. Muscle cramps or weakness can be both painful and frustrating, especially when they interfere with your daily routine. Vitamin D, in particular, is important for muscle function because it helps regulate calcium, which is essential for proper muscle movement. Meanwhile, magnesium and potassium help your muscles contract and relax properly, so a deficiency in any of these nutrients can lead to spasms, cramps, or muscle fatigue. If you're over 50 and experiencing muscle weakness or cramps, it could be time to evaluate your nutrient intake. The good news is that you don't have to suffer in silence. By ensuring you're getting enough vitamin D, magnesium, and potassium through your diet or supplements, you can improve your muscle health and regain the strength you need for everyday activities. So, don't ignore these signs. Take charge of your health and start addressing any deficiencies now. So there you have it, the top 5 warning signs of vitamin deficiency after 50. If you're experiencing any of these symptoms, it could be time to take a closer look at your diet, vitamin levels, and overall health. The good news is that with a few adjustments, you can tackle these deficiencies and get back to feeling your best. Remember, prevention is key, and making small changes today can lead to big improvements in your health tomorrow. Be sure to like, share, and subscribe for more health tips and advice on how to live your best life after 50. Thanks for watching, and I'll see you in the next video.